I'm Krishna Subrahman. I'm one of the local GPs and chair. I'm just not going to go around doing a full introduction. If I can ask the people around the table to introduce themselves when they speak first time or when with their names and roles, that would be great. And can I ask everyone to mute themselves and then unmute when they start speaking, please? Because there'll be echo otherwise. Okay, this meeting is being recorded and transcribed. The format is so that members of the public unable to attend can view the proceedings after the meeting had finished. The transcription is for the purpose of assisting with the minutes only, and it's not a formal record of the meeting itself. Okay. Any declarations of interest? Okay, I can't see any. No new interest or any interest in the agenda, on the items in the agenda. Can't see any. Okay, let's move on to the minutes of the last meeting held on the 11th of November, page number 7 to 11. I'm not going to do a page turner. Any amendments, any changes, any inaccuracies, please. Did somebody raise their hand and blowered? Oh dear. There are quite a number of people coming in from members of the public, so it's coming up as a participant raising a hand or something. Okay. Are we happy to approve the minutes?
Yes.
Okay,
Yes.
thank you. Action log, page number 12 to 13. One second, let me just get mine. So the first action 13-05-001. Now Robert Shaw is not attending today. Joy, can you give us an update?
Thank you, Chair. No, I have made a request on a number of occasions for both communications and engagement documents with regards to a particular development. I haven't received anything as yet. I think that's possibly because those plans haven't yet been developed, and so obviously our offer is out there to work with officers in terms of putting together or commenting on any engagement and communication plans they might devise.
Okay. Thanks, Joy, for that. We'll keep that open. The next one is, again, Joy. Malcolm Bryden is to provide this action to be kept open. That's what it says. I think he has spoken to you, Joy. Any update on that?
No, it's really the same for both items, really. We haven't really got much in the way, as I say, of concrete plans and proposals, and as I say, it might be that it's sort of too early in the development of phases of work in terms of both of those developments for that yet to have been developed, but it will be useful to know that, and obviously to have some sort of timetable as to when those plans, communication engagement plans with the local community will be developed, so we can hopefully work with officers or comment on anything that they put together.
We'll keep that open. 8.2.11.11.002.
I think you've got Russell's hand up, Krishna.
Okay.
Who
Russell?
give some clarity on those engagement points.
Yes, sorry, I just got kicked out of the meeting, so I missed most of what Joy was saying, but I assume these are in relation to the first two actions, is that right?
Yes.
Yeah, yeah. So the first one, there is basically there were two separate pieces of work which that we're developing across South East London around access to services, but also around things like primary care and access to primary care, and the different professionals and different types of appointments and different types of ways of accessing primary care. And those two projects have, but basically there was a realization that a short, sharp campaign was unlikely to have the impact and get improvements that we needed. So it's going to run for a longer period of time. And the two campaigns have been merged to kind of put more resource, and it just made more sense really. So that work is ongoing. But it's going to run for a longer period, probably starting, I would imagine, early April, and run for 6 to 8 months, with new content being added and developed as we learn as we go. So it's going to be a bigger campaign, which will hopefully be more impactful. But yeah, it has been delayed while we've done some of the research and insight work. Just on to Kidbrooke Village. So I had a conversation with Malcolm Bryden on this yesterday, actually. Well, basically, we have a meeting next week with. We've had some discussions with the practice that we'll be moving, but next week we've got a planning meeting with partners to discuss some of the comms and engagement, and that will be building on the engagement work that was done in September 20. There was a virtual event, I think, into the Kidbrooke Village. So there's more to come on that really, and when we have got a more detailed plan, I'd be happy to share those with Joy and others.
Thanks, Russell, for that update. Yes, okay. Yeah. The next action is on Emma Smith to provide board with a breakdown. The Burned at Buckley action on quality dashboard. For primary care. I chaired the Quality and Safety Committee today. The primary care dashboard is still being developed. So there was an item on initial thoughts on this only today in the Quality and Safety Committee at South East London level. Graham Hewitt from the quality team is going around the boroughs and meeting all stakeholders. Like, I think he's going to Bexley later this week, and he's getting invites to all the boroughs to co-design it, to engage with all the primary care and users and Health Watch. Fola K from Health Watch was there in the meeting today to develop this. So I don't think the dashboard is ready yet. So I think we should keep that open. When it's ready, it will be shared. I don't think it's ready yet. They are hoping for it to come to the May QSCC, Quality and Safety Committee in the South East London CCG. So hopefully we can keep that open. Items closed, action closed. We've noted that. Okay, Greenwich Borough Director's Report. Neil?
Okay, thank you very much, Krishna. It's good to see people, and it's good to see quite a wide range of members of the public here. I thought I'd just to help you in your chairing, Krishna, just right at the beginning, we haven't sort of clarified that there will be an opportunity for members of the public to ask questions at the end of the meeting, and there's a dedicated slot on the agenda for that. But the rest of the meeting is actually a kind of, there are key members of the borough-based board. So if people have questions during, if they got questions, please can you hold those back to the end? But obviously there are members of the committee who will have questions during items, and that's great. And hopefully people can all see us clearly on the screens. Yes, I wanted to just talk through my borough director's report, and as people might be aware, I'm actually on secondment 4 days a week to Lewisham and Greenwich Trust. So this is sort of a bit of a two-part item. And Jackie Davidson, who's the acting borough director, has been covering me for the last 4.5 months. And she's helped pull together this report, and she's having a well-deserved long weekend. So she's not here today. So I'll take the reports read. I'm not going to go through every bit of detail in it, but I did want to draw some really key attention to a number of key things. And the first is we're really in the process of the development of the integrated care system. People will be aware that this is the new legislation that's going through Parliament at the moment. We were hoping that that approval process would all be concluded for a go live on the 1st of April. We're now expecting that will be a go live on the 1st of July 2022, so it's subject to that final legislation. But we're very much in that transition period in building ourselves to getting ready for what will be an integrated care board across South East London, and we have each borough and place will have its own local care partnership, and for Greenwich that's called the Healthier Greenwich Partnership, which has actually been running for a number of years. So I just wanted to kind of highlight a few key things on that development of our local care partnership. So first of all, we had to make an agreement about the type, and so basically it is a committee of the NHS body is what we've gone for in the year 22-23, but we also have an ambition potentially to become a joint committee of the ICS NHS body as the partnership develops in future years. And people may have seen the white paper that's come out across the future of social care, and that very much talks about development of this place leadership arrangements and working together. So very much supported as a borough. So the executive place leadership is currently out for recruitment. So all members of the Healthy Greenwich Partnership have had notification of that, and that process closes on the 16th of March with interviews a week later. So we're asking people to put an expression of interest together. So hopefully by the time we get into April, we'll be in a position to start in a shadow form for the first quarter of next year until the formal establishment of the integrated care system. We will also be looking to appoint a chair of the local care partnership, and we are in discussions with the Healthy Greenwich Partnership members on exactly what the terms of reference for the job description for that will be, but we're hoping that we'll be able to put that local care partnership chair in place early in the new financial year. Then the fourth item I really want to draw attention to is the development of the Section 75 agreement, and that's actually quite a complex piece. So I'm going to pause on that for a moment and I'll come back to it. And the other thing we're doing in terms of readiness for the integrated care system is about establishing our care and clinical professional leadership. So in the borough, we've had clinical leads for many, many years working as part of the clinical commissioning group. They've all been GPs, and this new arrangement is saying it doesn't have to be a GP, and it could be, it's about care and clinical professional. So we could have social work input, we could have therapy input, nursing input, GP input, could have consultant input from hospitals, radiology, pharmacy. So all open to all of those different professionals in order to drive forward the improvement agenda in the borough. So we're in the process of recruiting those and putting that in place, hoping for more diversity and input into that. And then the second, so that's the kind of overarching thing. And then I did want to come back to the Section 75 agreement. So this is a joint commissioning agreement in the borough between the CCG and the local authority about where we jointly commission services and establishing a pooled fund. Now, we've actually had one of these in place for a number of years, but we've now got really integrated commissioning arrangements. And so we wanted to refresh our Section 75 agreement. And what we're looking for today is making a decision as the local care, as the borough-based board, to make a recommendation overall to South East London CCG governing body, and they have a meeting next week which will hopefully make a final improvement. And the reason we can't make the decision unilaterally is because the level of funding associated with this agreement is beyond our delegation. So we can make a recommendation, and so and that's what I propose, and it's been really well developed with across the local authority and with CCG colleagues to get us to that place. So that's quite a key decision we do need to make out of my borough update. I'm going to pause there to see if anyone's got any questions at this point before I go on to a brief update around epidemiology, and I might ask Steve to add any refreshed comments as Director of Public Health as well into that. Just checking if there were any questions from members of the committee. No, okay, I'm going to keep going. So within the report, we put in the latest epidemiology information, and this was as of the 2nd of March. So I think the rates are slightly changed from that. And Steve, I don't know if there's anything you want to highlight on the overall COVID levels at this point in time.
Happy to, Neil. So yes, we've moved from a situation where we have been seeing a sustained downward trend across all key indicators. So infection rates, positivity, mortality, hospitalisation, etc., have all been going down. That downward trend has now seemingly stopped and has actually started going up a bit again. It's very early stages, so we don't know whether that will be a significant upward trend or whether it will be a bit of a bump in the road. We've seen both of those before. My view is that it's likely to be caused by a combination of the end of the national restrictions and legislation. So no more contact tracing, no more requirement for people to self-isolate, and all of the other restrictions that had already been removed is bound to have an impact. Plus the Omicron variant, that is the one that caused this winter's huge wave, has now started to be replaced by a sort of second Omicron version. So it's still Omicron. It's not very different from the one that we've seen before. Doesn't seem to cause more severe disease, but it is a bit more infectious. So it will increase the number of people who catch it from the existing pool of people who have the infection. So I think we are starting to see an increase in cases. We are also starting to see an increase in hospitalizations, which usually follows on from that. But whether that becomes significant or not, we'll have to wait and see over the coming days and weeks. So I think those are the sort of key features of the current picture, Neil.
Thanks very much, Steve. And obviously then linked to the epidemiology is the important work on vaccination. So you'll see in the report that Jackie and I put together the update. So very much continuing our first and second doses in 12 to 17-year-olds through the school-based programme. Now 5 to 11-year-olds. We're starting that programme with those most vulnerable. And we've obviously, for anyone who's unvaccinated, first, second and booster vaccines available, and we've got sort of targeted outreach to do that. And so we really want to make sure that people are aware that they, even if they've not taken up the offer so far, they still can do that. And there's a whole campaign around don't miss your vaccine that's underway. And then in addition to that, anyone who's over 75, as well as anyone who's immunosuppressed, who's over 12, is being offered a spring booster. So this is sort of your 4th dose for some people, and that process is starting as well. So that's obviously particularly focusing on people like in our care homes, but also people over 75 in the community. and there's a lot of work. We recognise that there will be a September programme. We don't know what the detail of the September autumn programme for COVID vaccination going forward, but what each of the integrated care systems has been asked to do is put forward a process of saying, how do we do that? What's our approach? What's our mechanism? Because obviously it's taken up a lot of different people's time to deliver the vaccination effort so far, and we want to make sure that we can release people as much as possible back into frontline NHS services, whilst making sure that we can continue to deliver the vaccination programme in line with national expectations. And then the last bit within the COVID vaccination update of my report was there was a mandating of COVID vaccination for all NHS staff, which also followed for sort of care home staff, and that has now been rescinded. So that's been revoked, and that actually will go through Parliament next week as a decision. And obviously that was quite a sensitive area to work through. I'm pleased to say the majority of our health and social care workforce are vaccinated, and vaccination is really important, and I'll give a few important statistics relating to that shortly. But I did want to draw attention to the importance of vaccination. I can see Chuan's got his hand up. So, Chair, do you want me to take that question now?
Yeah.
Okay. Chuan?
Oh, hi. Yes, it's Tun Tran, local medical committee chair. Just a question for Steve, really, and it's slightly off topic about flu vaccination, if I may. I've heard that this for the autumn winter coming, that the younger age cohorts are not to be vaccinated as we had in previous years. It seems a surprising decision to me, considering, and obviously particularly in light of the new information about the Omicron version. Steve, do you think there is any scope for that decision to be changed, altered? Particularly lots of practices may have ordered supplies already, and it seems a bit of a waste. Thank you.
That's a really good question, Chuan, and I only heard about this myself yesterday, and was, like you, quite surprised. It seems like a very odd time for us to make a decision like that. I'm sure a lot of people will be expressing that same view. So I'll talk with my colleagues through the Association of Directors of Public Health and see what the view is. And I think it would be a good thing to kind of push back on, because it doesn't seem like a particularly sensible. I don't know what the rationale for it is. I haven't seen that. And if people like you are already kind of getting your stocks in, it seems all the more silly if you can't actually then use what you've ordered. So yeah, we'll have a look into that.
Thanks, Steve. Joy, did you want to ask a question?
Yes, and apologies for not introducing myself earlier. So I'm Joy Bichon, Chief Executive of Healthwatch Greenwich. And yes, I just wanted to raise that the sort of government U-turn on staff, compulsory vaccination for staff, has had a sort of a negative impact amongst some sections of the community with regards to the vaccination programme. As I think I've mentioned to some of you earlier, we've certainly been approached by people who are telling us that they are not happy to receive a vaccination, given that there's no guarantee that the person who's giving them the vaccination isn't vaccinated themselves. So I think it might be a harder push to get that this next tranche of people vaccinated for a fourth jab.
Okay, couldn't agree more. Nhs, do you want to carry on with your report?
Yeah.
Any comments?
I'll carry on with my presentation. So the last item that I wanted to come on to was the last point in my borough report was relating to this borough-based board. So we are proposing, in light of the ICS development, that this will be the last borough-based board. I know it says on the agenda that there'll be one in May. And indeed, there will be a meeting in May, but it will be the Healthy Greenwich Partnership, which we will be inviting members of the public to. So, but it will essentially carry out the functions of the borough-based board, but it'll be in the Healthy Greenwich Partnership, and so we'll be looking to put that in place, and we will be notifying members of the public of that. So I just wanted to let people know that. And then I've put in a presentation I gave to the Health Scrutiny Committee last week around winter, and I thought it'd be quite helpful to share here. So I'll quickly share my screen. I just talk through a couple of bits of information about what's been happening across while I've been on secondment to Lewisham and Greenwich Trust. So hopefully people can see the slides. So I guess the key focus for Lewisham and Greenwich Trust, where I've been on secondment as Executive Director of Winter, has been about, it's in the title, it's been about managing those winter pressures. And I guess there were three key challenges there. One was about managing the high demand at the front door of our services. Second, about the current and future COVID waves, and reducing lengthy lists for treatment. So I just want to give a bit of an update relating to each of those. So I guess the first thing to say on the high demand at the front door for our services, well, we've managed still to keep delivering our A&E services throughout, and that's a lot through the great partnership working we've had with others in order to be able to keep flow going. And the trust has been able to perform in the sort of top upper quartile performance in London. It's still below the national targets that we'd like it to, but we actually have been able to deliver services consistently for our patients. And the second was about the current and future COVID waves. And I've got a chart that I'll show you in a moment. Obviously, we didn't know that Omicron as a variant was going to come and how quickly it would come. But we've had to work our way through that. And then the third challenge was around our lengthy waiting lists for treatment. So when we were in the sort of September, October time, I don't know if you can see my mouse, but we were sort of in this phase after the summer where a lot of the lockdown restrictions were lifted. We had quite a high level of COVID happening, but at a kind of a moderate level. And then the sudden increase was when the Omicron variant started. And that meant in terms of inpatient numbers, we got up to about 250 across the trust. So you can see it was lower than the second wave for the trust, but obviously it was still a significant proportion. And that's about a quarter of all of the hospital beds across both the Lewisham and the Queen Elizabeth Hospital sites. So a really significant impact in terms of that. I'm pleased to say that we're now on around 60 COVID patients per day. That's what's been the case, and it's dropped down from about the 70 to 80 that we were a few weeks before that. So we've seen that steady decline from that peak of 254 patients. And the presentation of these patients is really very different from the first two waves. Only about a third actually have a primary diagnosis of COVID. So actually 2/3 are coming in with other things. But when we are testing everyone, as we do when they come into the hospital, we're finding that they might have COVID, and it's not necessarily the predominant reason for them to be admitted. So it's really important that COVID is not behind us yet, but that we work we work very carefully with our population around that. And so you'll see that if you come into the hospital, you still have to wear a mask, and we've still got some restrictions on our total visiting numbers in order to try and minimise the infection spread within our hospitals. And that is an ongoing challenge for us. And we recognise that public messages might be that they feel that COVID's gone away. It hasn't gone away, but we're having to learn to live with COVID, but we still need to be able to protect our residents really well within the hospital setting as well. So that does mean we still maintain different pathways as you come into the hospital, of whether you are a planned procedure before coming in, or whether you've got active COVID, or whether you're someone who is an unplanned admission, but we need to make sure that we're trying to mitigate that. So that's quite a challenge for the hospital. The other thing I really wanted to highlight was the importance of vaccination. So between the 15th of December last year and the 15th of January January this year, we saw 21 patients who had a primary diagnosis of COVID who needed to come in to our intensive care units. As of today, we have 0, and that's been the case for the last 3 days. But we had 21 patients who needed critical care treatment, far lower than the previous waves, but needed treatment. 95% of those 21 people who needed critical care treatment were unvaccinated. And sadly, of those 21, 7 passed away, and all 7 who passed away were actually unvaccinated. So I would really want to emphasize the importance of the vaccination work going forward overall. The other thing I really wanted to share with you was the winter pressures performance. So you can see our A&E performance has remained pretty steady, and we're in that upper quartile performance across London. It's not where we want it to be, but we still have reasonable performance, and we've been working hard with system partners to do that. And then the last piece I really wanted to highlight is about that we've done something quite amazing at the Queen Elizabeth Hospital, which is keep all of our elective surgery going for the first time in 4 years. So most winters we end up stop doing elective work, often in say December, January, February time, because the volumes of demand on the hospital are so significant. This time we've managed to keep that elective work going, and that's really important. So we've been able to reduce our waiting lists. They're still much higher than we want them to be, and they're much higher than they were before the pandemic, but we have been able to reduce those waiting lists, currently running at 1,800. So you can see the improvement that we've made, and that's really important, and that work will continue. And what's been interesting for me being on secondment is seeing the other side of partnership working, and we've had brilliant partnership working from the Royal Borough of Greenwich, from the CCG, working with our GPs, working with our GP Federation, and that's made a massive difference to the ability for us as a trust to run the hospital at this critical time. So I did want to give a bit of a perspective from my secondment role, because I thought that would be important to show. And then the last thing I wanted to highlight within all of this is, in order to make sure we did that, we had to add additional capacity. So we've actually put 2 new wards into our hospital, wards 24 and 25, to try and provide additional 36 beds to try and help us get that through. And we looked at new ways of working. So trying to keep our same day emergency care model, so people who can come in, get treatment and go home on the same day, as much as possible, so that we keep our bed base moving effectively. And all of that's helped us keep all of the services running as much as possible. And our work on cancer absolutely continues, because we still know that patients still have to wait often longer than they should. So I wanted to share that bit of information. I know it doesn't directly relate to my borough director role, but actually that's where I'm on secondment to. So I thought it'd be useful to share that with you all today. So that's the end of my borough director report, Krishna.
Thank you, Neil. Before I bring Tuntran in, do we know how many? What's the percentage of Greenwich residents who have not been vaccinated as of now, who haven't had even the primary course? Because it's those ICU admissions of more than 90% in unvaccinated. We don't want that to continue like that. Do we know how much? What's the magnitude of that problem?
Well, yeah, we do have the stats, and I guess it depends whether we want to know by age. We know it by age, but we know it by ethnicity. We know it by location. So
Okay.
In broad terms, is that we're running at about 75% vaccinated fully, but we know there are some people who haven't had their booster, who've had their first and second doses. We know that there are some, if you take the over 75s, over 90% are vaccinated. So the people who are probably most vulnerable, we've got the best uptake with, which is great, and that's really, really important. And those are the people that will be going out for our 4th dose during this sort of spring booster program as well. Yeah. But I guess an overall push on getting the vaccination up is still really, really important.
Is it worth some sort of intervention in partnership with our voluntary organization, Health Watch and all, to see whether that statistic of 90% plus admissions into ITU in your local hospital is from unvaccinated, at least to target the most vulnerable unvaccinated 10% or 20%, over 50 and over 75. Has anywhere else in the country that's happened, this statistic being presented in a sort of a focused way to the people?
So I think Lewisham Greenwich Trust is leading the way in some of the data, but we have shared some of those key messages already about the criticality of getting vaccinated and the impact of unvaccination, and those people are much more represented in our critical care. But when I presented these stats last week at the scrutiny, I think it was the first time publicly we've precisely quoted the facts, and there is going to be a report published by Lewisham Greenwich Trust relating to all of the outcome data that they've now got.
Okay, maybe in our comms from our integrated comms from the council, and where we take these information out, we could think about making it bigger and so that it's clearly visible to the residents. Okay, Tuan Tran and then Richard, and then Naomi.
Thanks, Neil. Really helpful report. Just to query regarding the elective work that still continue. I think that's really highly commendable at a time when the hospital's under a lot of pressure. You might have answered it already, but the reasons for that being able to continue, was it because of the new wards, the new pathways and ways of working? Just wonder whether they just can confirm. Thank you.
Thanks. It's actually really a combination of all of those things, because it's about keeping flow going in the hospital. So the extra ward space has helped, but probably it's about keeping the flow going throughout. So really good partnership working with Royal Borough of Greenwich, some additional funding that's gone in to support discharge, the integrated way of working with Oxley's and others to do that. But it's a combination of all of those aspects. But I think with the pathways being we've been trying to say very clearly, these are the green pathways, and which basically are planned elective admissions, and basically those wards and that space is dedicated to day case procedures or planned admissions. And those people had to have isolated in advance. They had to have COVID negative PCR tests before they went in, and basically totally separate staff that supported it. So I think some of those infection prevention control processes actually has also helped us in our overall capacity.
Thanks, Neil. I'm getting some questions from members of the public in the chat function, but probably I should have announced this before. We have got a dedicated slot where members of the public can ask their questions virtually. You can unmute and speak at the end. So we won't be able to respond to questions in the chat because we can't keep track of it. So keep hold of those questions and please ask it yourself at the end. We would have enough time. It's the question and answer session starts around 3:45. Richard?
Thanks, Chair. I'm Richard Rice. I'm the lay member of the Greenwich Borough-based board. Neil, I just wanted to follow on from Tuan's question, really. First of all, to add my congratulations to all the hard work of yourself and everyone else at LGT for managing so well through the winter. And really, I guess, given that you managed to carry on with elective work for the first time in 4 years, in other words, even before COVID, we weren't managing to do it. Are these changes things that we would expect never to have to close down the elective programme in the future?
Richard, you make a good point. I would hope that we're in that position where we can keep things going in future years. And I think we're always looking for what additional spaces within the Queen Elizabeth Hospital site we might be able to create additional bedded ward areas as well, because we know we've got a growing population overall. Probably the biggest challenge is workforce. The workforce is a massive determining factor. And so when Omicron hit, yes, we had to manage the 254 patients across the two sites, but actually the biggest challenge was we lost about over 10-15% of our workforce at various points in time. And obviously that had quite a big impact as well. So I think subject to future COVID waves, I think subject to keeping some of the good flow processes and discharges going, hopefully we'll be able to make sure that we can continue to manage the kind of elective programme going forward. There is a programme of work going on to look at additional capacity and more theatres in across London, and Lewisham and Greenwich Trust has definitely put forward an expression of interest, and we're very hopeful that we will get some additional theatre capacity as well, which will actually will help us in that elective backlog.
Thank you. Last question from Naomi on this item.
It's not a question, it's just an update. I was in a meeting with Public Health this morning and we were talking about continuing the Vaccine Champions programme, and hopefully there's some money that will come in for that, and that will mean really targeted work with communities or people of specific ages in their communities where there is vaccine hesitancy. So it's broader than videos, and it's actually face-to-face work to try and get people to understand what it means to have a vaccine, and actually it's not as scary as they think. So hopefully that money will come in and we'll be able to target some of those people.
Okay.
Thanks, Naomi, for that update. We'll move on to item number 6, the Section 75 agreement. This item is for approval. There are two different things. First, the board is asked to approve that the Section 75 agreement is recommended for approval at the NHS South East London CCG governing body as part of its Prime Committee's report. That's the first bit. Second bit is the Greenwich Borough-based board also is asked to prove that the NHS South East London Clinical Commissioning Group Greenwich Place Executive Lead be authorised to implement minor variations for the partnership agreement between the parties under Section 75 of the NHS Act 2006, subject to any variations being noted and approved at the place borough-based board. Okay, what do you need?
Yeah, so I wasn't going to go through too much detail in here because it is a very detailed legal document, and essentially it replaces the existing Section 75 agreement we've had in place. But we did want to put it formally through our governance. I can confirm it's been through both the CCG lawyers and the lawyers for the local authority, and we're in a position now to recommend it for final signature. So I'm happy to respond to some questions that have, but I want to sort of say massive thank you to people like Chris Dance, our Assistant Director of Finance, people like Andrew Shriven who've been involved in its development and its work to drive it forward. But happy to answer any questions anyone's got.
Okay, I can't see any hands. So are we happy to approve this and recommend it to the South East London CCG governing body under those two bullet points, and also let the borough-based executive lead to authorize to implement minor variations?
Yeah.
Okay.
Can I suggest one minor wording change, which is any subject to the point about last point of the second bullet says subject to any such variations be noted and approved at the place borough-based board. Given this is the last one, I think it's through the place borough-based board and its successor organisation and its successor body. If we can add that comment in, I think that will help us.
I'll request that.
Yeah, Alex has noted. And are we happy to approve it with that thing noted? Yeah. Okay.
Thank you.
Great. So that's approved under both, along with that minor amendment. Now we are going to the assurance section. Item 7, page number 77 onwards in the papers. Performance assurance report. Omar Al-Ramadani.
Thank you very much, Chair. So I'm Omar Ramadani. I'm Head of Assurance at South East London CCG. Chair, would it be helpful for me to bring the report up on the screen, or would you prefer that I just talk through it?
No, on the screen, and if you can show the slide which you're referring to would be great.
Okay, great. Thank you very much. Okay, so So I'll take the report as read, but I'll briefly touch on some of the highlights before handing back for comments and questions. We have a couple of summary slides at the sort of beginning of the report, so I'll quickly go through those. So starting off with the mental health metrics. So the Greenwich IAP service achieved a recovery rate of 53.3% in November, which is compliant with the 50% target. The service did, however, report a deterioration in waiting times in November for those waiting over 6 weeks to enter treatment. The CCG's performance team has been monitoring performance and has raised this with Oxley's, who believe there might be a slight data reporting issue with the 6-week target, and they are trying to resolve that. It's just worth noting as well that that 100% of patients are entering treatment within 18 weeks. So it doesn't look like it's a broader kind of waiting times issue with the IAP service. Moving on to dementia diagnosis. So performance, although below the 66.7% target, we've actually seen a slow but consistent improvement across the last 12 months. So if you'll remember, around a year ago, we were reporting a dementia diagnosis rate of around 60%. That's slowly been increasing to just under 65%. And we're expecting that to continue to improve because the service is increasing its capacity. So it's carrying out more initial assessments. It's running or will start running a Saturday screening session to help reduce the backlog. So that should continue to increase. On SMI physical health checks, so a Q3 position wasn't reported by the borough, so we've just carried over the Q2 position, and that's what we're actually reporting in this report. I don't know the status on the reporting on SMI physical health checks at Greenwich at the moment, and if reporting will resume in Q4. So if there is anyone, a borough colleague that could provide an update on that, that would be really helpful. And then finally, I'll touch on NHS Continuing Healthcare because we've added a couple of new slides. So we're now providing performance on the proportion of assessments carried out within 28 days and the number of incomplete referrals over 12 weeks. Greenwich is actually red rated on both of those metrics. So on the 28 days assessment, 36% were completed within 28 days for Q3 against a locally agreed target of 50%. And the borough is also reporting 32 incomplete referrals over 12 weeks, which was the highest in Southeast London for Q3. So I think that's it from me on the report. Very happy to hand back and take any questions or comments.
Okay. Neil?
Yeah, thanks Omar for your summary. And I just wanted to draw. I haven't got the numbers to hand around the SMI physical health checks, and we'll be able to follow up on that. I just wanted to say on the diabetes treatment targets, we've seen a massive improvement actually in a lot of the work on early diagnosis and early identification of people with likely development of diabetes. And it's literally a tenfold improvement there. So that won't yet be seen through in these figures, but we're expecting that will start to come through overall. So there's been a really strong improvement in diabetes across the board. And in terms of continuing healthcare, we've actually had a number of real significant challenges within that team, but I'm pleased to say that the team have really driven forward a lot of improvement work to do that. But we haven't yet seen all of the fruit of that, which I think will start to come through early in the next year. And obviously this year, this data is Q3, so that's up until the end of December. So I'm expecting that we will see that improve significantly.
It's great. Yeah, the diabetes thing Neil is referring to is it's before you get diagnosed with diabetes, catching things early and referring you to a intervention, structural education, weight loss, and all that to stop becoming diabetic. That's gone up tenfold, the referrals from the GPs to that Southeast London program. But the actual thing which in the slide is the treatment targets of blood pressure and all that. Once you're diagnosed with diabetes, and then your foot checks and your eye check and all that. So for that, we are rolling out a new way of working with Eclipse Business Intelligence with an Ardence, which now that we have all the GP practices in EMIS, you can pull data, you can analyze it, and you can use that to recall patients who are not meeting those targets. And there's a nice Norfolk general practice model. We have had so many webinars for GPs, and it's been presented, and we are going around the PCNs to implement that as part of our diabetes transformation program, and training up lots of GPs and practice nurses to initiate insulin injections and all that in the community. And that should be up and rolling by October this year. And that should make a huge impact on those two targets. Because Bexley already did that 4 or 5 years back to a certain extent, but now we have got this business intelligence that should make a big difference. Richard and then Sabah.
Thanks, Chair. Yeah, with regard to the SMI mental health checks, where we've missed that target by a huge margin, and I recognise that it is Q2 data, as you said, so it's kind of old bad news, but it's still bad news. I'm just wondering, was it COVID that caused that problem? Was it just difficult to physically get access to these patients to carry out the checks? I'm wondering what the underlying cause of that is.
I'll say a couple of bits, and then maybe colleagues would like to chip in. So just broadly speaking on SMI physical health checks, we did see a major, significant drop in performance throughout the pandemic. So across Southeast London, performance pretty much halved throughout the pandemic. We have started to see an improvement from actually Q2 and in Q3, and we expect that improvement to continue. There is a concerted effort across Southeast London to really focus on SMI physical health checks and to drive improvement across all the boroughs. But yes, I mean, there was a real reduction due to the challenges of the pandemic and the drop in face-to-face GP appointments.
Thank you. Sabah and then Tuan.
Thanks, Krishna. I was just going to add another point just on the diabetes with the work that Clinical Effectiveness South East London is doing. Our second tranche is focused on diabetes. So as part of that, we're producing a guide going out to visits and doing practice facilitation. So hopefully further embedding the work of the diabetes that's already taking place.
Thanks, Sabah. Tuan.
Hi, yes, just hoping that maybe Omar and Krishna can help with, just to clarify my mind, this kind of like performance report comes from SEL, is kind of borough level report looking at the different target performance areas. The primary care dashboard, Krishna, will that be more local base? Would it be more around practice base? I'm just trying to understand, get in my mind how these two will interrelate. Thank you.
Omar, do you want to start?
To be honest, Christian, I'm not too aware of what's presented in the primary care dashboards. But if you're more aware,
okay. So the primary care dashboard would be owned by the place, basically. It would be practice level, and it wouldn't be just on this. It would be on access. It would be on. It's yet to be co-designed. So it's. As I said, from the Southeast London quality team, Graham Ewitt is going around all the places, meeting primary care colleagues, other stakeholders and partners within the partnership, and it's to get their input in designing that, putting things together, what would be very useful to look at to improve the population health outcomes. So that would be owned by the place, I think, the local partnership. How we link these two, the performance at Southeast London at borough level with this, probably this would be primary care dashboard would be a bit more in detail about practices across lots of things, but then we'll have the borough level performance, then we'll have the Southeast London performance, you know what I mean. But then primary care dashboard is only one performance in resource within the place. It would also has to tie in with the other community services performance within the borough. So the place, the local care partnership, the Healthy Greenwich partnership will be looking at all that.
Thanks, Krishna, because sometimes practice can give an idea why the information and statistics might not reflect what happens in reality. So those kind of nuances can be helpful for the local discussion. Thank you.
Okay, that's great. Thanks, Omar, for that report and good discussion around it. Let's go to item 8, starting from page 133 in the pack. Greenwich Borough Finance Report. It's for information budget setting as well. Chris Dance. Highlights, please, and then.
Thank you very much, Chair. Yes, I'll work with the assumption that the papers have been read, so I'll just draw attention to a few highlights. As per the table on page 140 of the report, which is there for your reference, Greenwich is 195k favourable at month 10. This is a very slight 19k movement from month 9, and so it's really assuring that we're sort of getting a stability on the right side of the line, if you like, as we approach the financial year end. All boroughs are kind of sharing that correlation of just, again, being on that right side of the year end. And as you look on the table, we're kind of mid-position. So we're cautiously optimistic that we're in a good place to deliver all our objectives for the current financial year, which is fantastic news, and credit for the team for all their hard work in doing so. If you look at the very right of the column, it looks a little bit worrying at first glance, because it would suggest that we're 11.1 million adverse as at year end. However, I would just stress and caveat this is predominantly spend related to COVID activity, predominantly the hospital discharge programme that we've been running this year. And as per prior months, we will be getting fully reimbursed from NHS England via retrospective allocations. So just to stress, that is purely a timing difference, and that the forecast for the wider CCG for the financial year end for this year is a break-even position. So that's the key message to note. There are subsequent slides which then give more detail specifically on areas of COVID spend, debtors, creditors, cash position, and so forth. So the second set of papers I just want to again very quickly highlight, starting on page 149, just for information only, and this is just intended to give the borough-based board members an insight into the budget setting process for the 22-23 financial year, which we're just emerging through now. The subsequent slides set out the construct for how we've set the budgets, which is effectively using baselines from last year, applying the tariff inflation, various growth allocations, for example, MIS standards and so forth, to then derive an overall envelope, which again is within the slides, and for Greenwich is £161 million, which is contrast to this year a £2 million increase. The approach has been the same across all boroughs. Formal sign-off, as outlined in the slides, is scheduled for mid-March, and I'm pleased to report that internally within Greenwich, we're kind of nearing the end of our internal planning processes and cautiously optimistic that we've managed to capture all our expenditure plans, growth incentives, etc. within this envelope, pending formal sign-off. I just realised, apologies, Chair, I don't think I introduced myself at the very beginning, but just for the benefit of guests, my name is Chris Dance. I'm the Associate Director of Finance. And that was it in terms of highlights from me. Thank you.
Open to discussion. Any clarifications, questions, comments? Neil?
Yeah, I just wanted to thank Chris for his report and the clarity of it. I mean, it's been a huge amount of work to get to where we've got to, and I personally wanted to thank Chris, who has been on secondment initially to us, and I'm pleased to say that he was successful in his interview last week to permanently get the job. So I'm delighted for that, because Chris has done some really good, important work for us, supporting us and helping us as we work through the financial challenges and getting the right framework going forward. So I think that's good news for us as a borough as we work through. I do think we're in a strong place going forward, and I'm really pleased with the sort of collaborative approach that we've got. But clearly there will be challenges going forward as we try and work that the sort of the financial challenges through. But we've had some really positive news, and I don't know, Chris, if this is in the paper, but there is some support that the local authorities are all going to be getting from South East London ICS, which is quite significant, which will enable some of the national funding that has been put in place through COVID to be continued through 22-23, which is really important. We need to continue to work out what the solution is for future years beyond that, but I think that's really good that that support is available. So hopefully that means that things like a hospital discharge programme and some of the schemes we put in place to keep flow going that we talked about earlier can continue during the year.
Oh, that's good news. First, good news that you've got Chris permanently now. The next one is he brings with him some money to local authority. Thanks, Neil, for that update and reassurance. Richard?
Yeah, not really a question for Chris, but for the board generally. I'm a little bit concerned about the continuing healthcare. There's quite a significant overspend there, which is kind of being disguised in the overall figures by other areas that are underspent. But I mean, what's going on? Is this an area of the budget that we can't control, or do we understand why these overspends are happening?
Thank you. So if you're happy, I'll just sort of start the answer to that. Thank you, Richard. That's a really important question you raise. And as you say, I didn't share my slides, but I've always tried to be transparent in prior meetings about talking about how CHB has been an issue for the current financial year and to an extent been offset. So what we've been doing behind the scenes is quite an intensive piece of work. I think the issue with the CHC is basically the robustness of the database. So there's a patient database which underpins all the treatments for all the patients, and that information is collated on a database which we use to kind of drive our ledger position. As we've progressed through the financial year, it's not a concern that there are more patients than we've budgeted for. It's just sometimes there are historical anomalies in the database which are then translating through to that final answer. So there has been a very intense, dedicated piece of work, and we've had additional resource to effectively cleanse the database, for want of a better word. And I'm pleased to say that earlier on today, when I had to duck out of the Healthy Greenwich Partnership for a month-end 11 insight meeting, there had actually been a substantial improvement in the CHC. So we're beginning to see all the hard work which we've put in the previous quarter now translating into improved position for month 11. And as we move into budget setting and moving into next year, we're confident that the envelope we set will ensure that we're on a robust, even keel moving forward.
Happy with that, Richard? Yeah, continuing healthcare, it's every year it is a challenge, isn't it? But the team works really well to sort things, and it's a perennial thing. It's people moving from childhood, being a child, into an adult, and the things. Okay, that's great. And this local authority funding we are getting, Neil, is that a recurrent thing or a one-off?
It's a commitment. It's a commitment to all 6 boroughs from South East London ICS for the whole of 22-23, and there's an indicative amount that's been allocated and written to. I think there's an indication in there that we need to do solutions for future years, but we don't know what those solutions are yet. So there isn't a commitment beyond yet. But we know basically if we want the whole system to work, so if you join up the elective, there's a lot of national focus on tackling all of the backlog in elective procedures. We know there's additional funding to support hospitals do that. In order for them to do all those elective, they need the bed spaces in order for those patients to go through. Therefore, you need to keep discharge flowing really well. So there's questions about how can we move some of the money around the system to make sure we can keep things going really effectively as a whole system, so that we get the best outcomes for our population. But that will be a decision for next financial year.
Okay, that looks like a good plan. I can't see any more hands on this item. Thanks, Chris, and congrats again.
Thank you.
Shall we move on to the next item, which is Greenwich Borough Risk Register. It's page number 165 and Appendix A. Alex?
Okay, thanks. Yeah, so in terms of new risks added, I'll start with that because it relates to what we were just talking about, which is the CHC overspend. So that was added, I think, a few weeks ago now, and that was scored as a 25. And the reason for that being was, I think, a lot of the mitigations which Chris just talked about were not yet in place. I think the next time that risk is due a review, which I think is in the next week or two, that should be probably scored down from a 25 maybe to a 20 or a 15. So that's the only new risk that's been added since the last time this was presented to the board. Then the rest of the updates are really just sort of good housekeeping kind of items. So there were a number of risks, I think 6 risks in total, that were under the integrated commissioning umbrella that really refer to like quite outdated language that or you know, legislation changes and that kind of stuff refer to an environment that now no longer exists. So they've been removed. There are now a number of risks which are in draft form at the moment. We're just sort of working on the scores and recording the mitigations and how the assurance is going to be reported, that relate to place-based partnership working and organizational culture that are going to be on the register by the time of the next meeting. There were also a couple of risks that related to sort of the Brexit transition period, which very obviously don't apply anymore, so they've been removed. There were also a few risks in relation to sort of the immediate sort of challenges of the COVID pandemic, which again have been removed. And there are a couple of other risks which we're drafting in relation to more sort of COVID recovery and ongoing management of COVID, which as before are sort of in draft form, again working on scores, responsibilities, risk owners, sponsors and mitigations, but they should appear on the register by the time of the next I was about to say borough-based board, but next meeting in public of the Healthier Greenwich Partnership. So yeah, that's my update. If there are any, I appreciate this went out late, so if anyone has any comments on the register, just feel free to email me and I'll pass this on to the risk owners and risk sponsors.
Thanks, Alex. Any comments? Okay. It's great. So we are running quite ahead of time, which is really good or bad. Okay, if we can email Alex if we have any comments on the risk register and all that. And what would happen, Alex, to the risk register when we transition to, or Neil, to Healthier Greenwich Partnership taking over, or the borough-based board being succeeded by a future committee? Neil?
So essentially, it's the borough's risk register. So we just happen to report it at something called the borough-based board, and we'll report it at the Healthier Greenwich Partnership going forward. But the way it's framed at the moment is very much on the NHS risks associated with the function of the CCG in the borough. And it may well be in time that the risk register transitions. As we said initially, the Healthy Greenwich Partnership, in my borough director's report, is being a committee of the South East London Integrated Care Board, which will be in existence. So in future, potentially, if we become a full joint committee working with the local authority, then it may be that the local authority risks might be blended into that. So that's something we could definitely consider. But I think initially it will be this version, but updated, that would come to the next public Healthy Greenwich Partnership meeting in May.
That's great. Chip?
Yeah, given that we've got a little bit of time, I'd just like to thank Alex and all the others that have done work on the risk register, because I think it's actually a much more realistic document than it has been in the past. So I know that a lot of work's gone in the background, and I think it really does summarise the risk quite nicely now. So thank you for that.
Yeah, I would agree with that. It's a lot more clearer, and it's a dynamic document. Thanks, Alex and colleagues. Okay. Any other business? Neil?
Yeah, so just one item of AOB, which is just to say that my secondment with Lewisham and Greenwich Trust comes to the end on the 5th of April. So I'll finish on the 5th of April. I'm actually taking some extended leave for a couple of months. And so Jackie Davidson and Robert Shaw will continue their acting up arrangement, and I should be back fully in Greenwich from the 6th of June. I wanted to update the borough-based board to that effect.
Okay, that's great. And I think on that note, I think Saba and myself, who are the clinical leads sitting in the governing body in South East London CCG, we've been asked to job share and continue the role till July, till when the CCG will be there, and then it will be taken over by ICS. So we'll be continuing in our role in South East London. We'll also be as governing body members, and we'll also be contributing to the local care partnership and all that till then. And Richard, you want to update your?
So just to confirm, Richard, I don't know if you heard that, but basically confirmation about you as a lay member continuing in your role through to the end of June.
Yes, that's currently the case. So I'm continuing till the end of June, and we're not sure what happens after that. There's currently some discussion going on about the role of lay members at place, and we'll see what happens when that discussion comes to fruition.
So that's any other business. Okay, the next meeting, as Neil said, would be on the 12th. Thanks, Joy. You have to leave early. Thanks. Next meeting will be on the 12th of May at 2 o'clock, but that would be the Healthcare Greenwich Partnership, to which public will be invited, similar to this meeting. There might be a part 1 and part 2, like a governing body meeting used to happen. So that's the next meeting. So this is the last borough-based board for Greenwich. Okay, now over to question and answer section. So this is the chance to ask you questions. I think there was a question from, was it Emma or something, around vaccination. If you can unmute yourself, and also if we can see your face, it would be great. So click on the cross on the video as well. And if you can ask your questions, we'll try to answer. Elizabeth.
My name is Elizabeth Munsey, and I put a question in the chat about the vaccinations. A lot of the younger cohort of men around here are looking to social media from America for guidance about taking the vaccination and taking the boosters. They're not happy with what's being reported. And I saw in the chat that a leaflet and a link were put up, but they're to do with the UK. They're not to do with what these young people are accessing on social media. So I was wondering what was being done to address this potential for misinformation.
Thanks, Elizabeth. That's such a valid question. Sometimes it makes me really angry, but I'll let Neil answer.
So I might bring in Russell Cartwright as well, but we for South East London, we've developed a vaccine facts website, which is to try and kind of mitigate that and to make sure we've got one place where we put all of the key vaccine information together with a variety of information. So Russell, I don't know if you want to explain a bit more about what we've been doing, but obviously we can't act as police about what people look at about American social media. But Russell, do you want to set out what our approach has been?
Yeah, sure. I mean, so we've been using social media a lot, particularly with young people as eligibility has come down the cohort, and we've been using social media channels used by young adults. We've had a lot of success with things like Snapchat, Instagram, and things like that. But actually, with the work that we're running at the moment, targeting young adults, we're the agency that we're working with, they have a misinformation cell, which is one of the few services like that in the country, and we're working with them, and they're kind of informing how we respond to some of the misinformation that we get in comments and things like that to our posts and our adverts. I mean, it's not perfect. You're never going to reach everyone. It's impossible, unfortunately, to stop everyone seeing, you know, some of the misinformation. But what we are doing is putting out accurate information and getting really good, you know, reach with that. Through the way that we've targeted it, and that's with the vaccine fact stuff, plus the don't miss your vaccine campaigns. So you know, we're putting the correct information out far and wide, and responding where we see misinformation with an evidence-based approach, which does help change the tone of some of the comments.
That's great, Russell. Not just young men, that's for Black and ethnic minorities. I remember doing videos in a couple of languages, and it's in the Southeast London, and as did lots of other governing body members and members of staff, even in other languages. We try to present an argument, evidence-based argument against misinformation. Okay, I think NHS vaccine resource has been put in. Oh dear, somebody's sharing the screen. Who's that?
I think that's Gilles, accidentally. So.
Okay, I think Neil's just put in the resource, Elizabeth, which you were asking for in the chat section. Paul, I know you've typed your questions. Do you want to ask it yourself? You unmute yourself. Oh. Alex, Paul can't be unmuted for some reason.
I don't think I can remotely unmute him.
Okay. Shall I just read out Paul's question then?
Yes. Yeah, I can only mute him, not unmute.
Yeah, you can. Okay, 2 questions. Clarification of organization plus status of Circle MSK contract. So, Neil? Oh, I'm seeing some hand up.
Okay, yeah. So I can. So the Circle MSK contract continues at this point in time, and they've been continuing to deliver a service. I think through Chris and Robert Shaw, we've negotiated for the next financial year of that contract to continue to deliver the MSK services. But we're not yet at the point where we need to go through a re-procurement exercise. I think there's a view that across South East London, we would be looking, at the moment, we've got quite differential MSK models in different boroughs. And so I think there will be a plan to bring that together to look at what the best model is across South East London going forward. But at the moment, we in Greenwich will continue the Circle MSK service. I'm not quite sure what you mean by clarification of organisation question, Paul, and whether you're referring to Circle specifically in that question, or whether you were talking about the ICS. I'm not sure if you can unmute yourself because we can't hear you. Bless you.
Paul, if you can, if it looks like you can't unmute yourself and we can't unmute, so if you type your any clarification you may need in the comment section, I'll pick it up. Any other questions to the board on anything health and care related, or what we have discussed in the meeting? You can raise your hand, or you can, if you reveal your face through unclicking the video, I will know that you want to ask a question.
I'm here.
Ah, yes.
Well,
Eureka! I went off and then I came back on. So it's not the greatest thing, this, is it? Can you hear me now all right?
Yes, we can.
Good. The organisational one is that I'm beginning to, I mean, I probably lost the plot years ago, but the thing is becoming quite complicated in knowing who does what, who's on what, and how public engagement occurs. I mean, for instance, the Healthier Greenwich Partnership, which appears to be a local care partnership, which was the Healthier Greenwich Alliance, which was the Health and Wellbeing Executive Committee. It's these things that are a bit confusing. So it would be quite nice in the near future for the CCG to produce an easy guide for people like myself to understand who does what, who's on what basis, and what's the public engagement at that level. That was the organisation question. Is that okay? The circle one is that I, looking over some of my ancient documents, was that the circle contract started in the 1st of April 2017 after some delay, and I couldn't find anything to say what had happened up to now and whether and what scrutiny have been made of their performance in those 5 years in order to give them, as you say, I heard what you said about a year's extension. I've also asked questions in the past, obviously, about the interconnection via Centene of primary, a major the MSK project, and also private hospitals, and how that is monitored. So, I mean, those are questions. Certainly when 80 medics came up, I was told, I think one of the meetings, that that sort of relationship was not looked at when due diligence was made, and I'm a little concerned about it in terms of the scrutiny. I mean, now Circle is wholly owned by Centene. You know, did you hear that all right? Yeah, okay. Those are the two questions.
Thanks, Paul.
I'm glad to get on.
Okay, thank you. So I'll answer your first question first. So that was relating to the organisation and the engagement work for the ICS, and a sort of easy read, simple to understand way of understanding the new organisational structures and how we engage with it. I think that is a really welcome question, and it is definitely one that we're planning to do. I think one of our challenges at the moment with the ICS is it's not yet legislation. So until it becomes law on the 1st of, well, we don't know when it will pass, but we're expecting it will be passed soon. And then we're expecting the go live for the legislation will be the 1st of July. So that's what we're all working to. I think once we know that for sure, then we'll be in a position to be able to very publicly kind of communicate all of that. But obviously, when it's still in Parliament and it's still having its second reading, etc., it's only when you get to the final royal assent, you know that the bill is secure and you know what the process is going forward. And I think that's where we are. It just creates a bit of a challenge, but Paul, we can definitely create something to help that. And I think we had an interesting conversation actually in the Healthier Greenwich Partnership, and well done for remembering the what was the Health and Wellbeing Exec, which basically was a subcommittee across all of our organisations of the Health and Wellbeing Board, is the one that then got named the Healthy Greenwich Alliance, and we just renamed it Health Greenwich Partnership, just that it sounded more similar to the local care partnership, but we wanted to make sure it was clear this was Greenwich's local care partnership. And so that's what we've got going forward. So I think your question is good there. And then the second question about Circle MSK. So we do scrutinise their performance closely as a CCG. As you'll understand, obviously we've been in a pandemic for the last 2 years, so a number of things have been a bit different. And so some of the areas where we might have gone for big re-procurements and things like that, it wasn't the time to totally reconsider services when you're in the middle of a pandemic. But overall, they seem to be doing a good job. But it's important that we make the right strategic decisions on that. And we know that a big procurement process for something as sizable as that can take a number of years to be worked through. In terms of the ownership model, I think those issues have been covered previously, and I guess our contract is with Circle MSK, but as you've highlighted, sometimes organisations have different ownership structures above them, and that's what you've sort of drawn attention to, and we are mindful of it. But as far as we're concerned, it's not changing the service that's delivered for the residents of Greenwich, which is the important thing that we consider.
Okay, thank you. Okay, that's great. I can't see any more hands up for questions. Thank you all for taking time to participate, especially to the members of public, for taking time with all the virtual digital challenges and all that. So we will all meet again on 12th of May in the Healthy Greenwich Partnership meeting, where public will be invited. Till then, take care. Thank you.
Thanks, Krishna. Bye, everyone. Thanks, everyone.
Bye-bye. Thank you. Lovely to see some of you, and good to see so many different members of the public as well.
How do we get off here?